District Health Board midwives have rejected a pay offer and voted to go on strike later this month. MERAS, the union for DHB employed midwives, says they were offered the same offer that nurses accepted in August. That was a minimum of 12.5% over the next 3 years. But midwives say they have more training and responsibility than nurses and therefore should be paid more. They asked for an additional 3% or a $5,000 retention allowance until pay equity is resolved. But they say the DHBs rejected both of those proposals. Now 90% of the midwives who voted in the recent ballot have rejected the DHB's offer. I asked MERAS Industrial co-leader Jill Ovens how the workforce had reached what the union is describing as crisis point.
There's a huge midwifery shortage in New Zealand, and so there are a lot of vacancies around different hospitals, and at the same time as we have actually fewer midwives employed in DHBs, the population has grown, particularly in areas like Auckland, and the level of acuity and complexity of birthing has increased. So there are more difficult cases and fewer midwives in the DHBs.
So you were, as you point out, the midwives were offered the same as the nurses and the nurses' pay scale. So what, at a minimum, the pay increase would be 12.4% over 18 months. What's wrong with that?
They were really wanting to have a differential in that would recognise that they have a high level of responsibility and that they are different professional group. So they've been asking for this for a long time, and it's just got to the point where midwives are expected to just wait till the nurses settle and then roll over and take whatever's offered. And one of the things that's really unfair, which we did try to address, is that a new graduate midwife has done an equivalent of a 4-year degree, and she is competent. She is expected to deliver babies and do her full scope of practice from the day she starts, whereas a new graduate nurse has got a 3-year degree and requires a lot of supervision. They get paid exactly the same.
So you say that a graduate midwife is worth more than that graduate nurse. How much more? What's your number? What would make you happy?
Well, we suggested that they start on step 3 of the salary scale.
So how much of an increase would that be?
I can't tell you off the top of my head, but right now they start on $49,000.
Right, and so what would they be paid if they started on step 3? Am I reading right when it says about 56,000? Does that sound right to you, Jill?
That does sound right. I'm just trying to look it up, but yeah, that sounds right.
That to a lot of people is a massive jump. You know, and at a time when people are getting 2% pay rises.
Well, if you think about 50,000 as being approximately $25 an hour, it's not very much, is it? It's below the average wage. So, and these midwives have a very high responsibility. They're helping to bring into this world our next generation.
So do you think lives are being put at risk, mums and babies, with current staffing levels and the condition that your midwives are working in DHBs?
The DHB's own report, Workforce Information Report that they released in September, describes it as a crisis. And so I think that midwives work incredibly hard to ensure the safety of women and their babies, but it's under increasingly difficult conditions.
So the strike that they've voted for between the 22nd of November and I think it's the 5th of December, how will that work?
Well, what we've done is that our goal is to, obviously the goal of all strikes is to cause disruption to the employer, but what we want to do is to minimise the effect for women and their babies. So we're taking just 2-hour strikes every day, twice a day at different times of the day.
So will there always be a midwife available?
Yes, because under the law we have to provide life-preserving services, and we've just been this afternoon talking to the DHBs about that.
But aren't you actually, what you'll end up doing is putting the person who's on shift under more stress, won't you?
Well, we are offering to have somebody else available in the DHB on site if they're needed, more or less on call, which is unusual because normally when you go on strike you walk off the job and you have to leave the site. So that's still to be resolved with the DHB, but that's our offer.
You're offering emergency cover in essence.
That's right, yeah.
Jill, the nurses got a commitment to extra staff as well as their pay rise. Are you asking for a workforce increase as well?
Yeah, that's actually one of the sore points because our understanding was that those extra staff were supposed to include maternity midwives, but it seems that the amount of money that's been put aside, while it seemed huge, was really only probably enough to ease the nursing shortage. And so we are in discussions with the Ministry of Health, and I was talking to them as well today about having a separate provision, a separate accord, if you like, to particularly look at the issues across the whole midwifery workforce, including those who are self-employed in the community that LMCs lead maternity care.
MERAS Industrial Co-Leader Jill Ovens and DHB spokesperson Jim Green will join us live after 6.